If you're planning a shoulder surgery like a rotator cuff repair, you've probably heard me talk about avoiding pitfalls and the use of biologics to boost healing. But here's something new. Your cholesterol profile might actually predict how well your tendon heals after surgery. Welcome to the Shoulder and Arm Health channel, where we talk about the latest and best in shoulder and arm care. A recent study by Ding and colleagues looked at 202 patients undergoing rotator cuff repair. They measured some cholesterol markers, specifically apolipoprotein B and apolipoprotein A1, or ApoB and ApoA1. What they found was striking. If your ApoB was over 140, your risk of the tendon failing to heal was almost 10 times higher. And if your ApoB to ApoA1 ratio was over 1.8, the risk was about 5 times higher. Why does this matter? ApoB reflects the number of bad cholesterol particles that can infiltrate tissues, like your blood vessels and your tendons. ApoB is actually what makes an LDL particle a bad cholesterol particle, and it allows the LDL cholesterol to enter and get trapped in the lining of blood vessels. These particles create inflammation, reduce microcirculation, and may even physically make it harder for your tendon to reattach securely to the bone after surgery. So dyslipidemia, which is reflected by a high ApoB or an imbalanced ratio, creates an environment that suppresses healing. If you've not had a recent cholesterol test, now may be a perfect time to get it checked. You will likely have to ask specifically for an ApoB and ApoA level, since most basic lipid panels don't include these specific tests. But if you've had a previous cholesterol test and it was just a basic lipid test, we can still make some inferences or make some sense of those results. First of all, if your LDL and HDL are completely in the normal range, it's also very likely that your ApoB or ApoA to B ratios will be normal as well. And if your LDL is high, say above 150, your ApoB level will likely be in the danger zone, as well noted in this study. In that case, you may want to consider options for lowering the bad cholesterol, at least around the time of your surgery. Cholesterol-lowering drugs are very effective, and even if you don't want to be on them long term, it may be a good idea to modify that risk factor to stack the proverbial deck in your favor. Other medical conditions such as diabetes or smoking or low hormone levels have been shown to affect healing, so you want to have all of your health markers optimized before surgery. Discuss timing with your doctor. Sometimes waiting a few months to improve your metabolic health can reduce complications and improve healing. After all, that's the whole reason why we're doing the surgery, is to get the tendon to heal. Your shoulder surgeon is focused on repairing the tendon, but your biology is what allows the tendon to reconnect to the bone. Managing your metabolic health is one of the smartest ways to set yourself up for a strong, lasting repair after surgery. Thanks for watching. Please share this video with anyone who might benefit from the information.